Hello everyone, I'm Dr. Lei Xu from the Department of Gastroenterology at the First Affiliate Hospital of Ningbo University.
And I'm Dr. Jiarong Xie. In this study, we evaluated whether post-snare polypectomy could be a safe and practical alternative to whole-snare polypectomy for pedunculated colorectal polyps.
Pedunculated colorectal polyps are commonly encountered in routine endoscopic practice, and the current guideline still mainly recommended hot snare polypectomy for these lesions because HSP relies on electrical quarterly. Thermal injury and delayed post-polypectomy bleeding remain important clinical concerns. Electrocular related injury may also contribute to post-procedural discomfort. Cold snare polypectomy avoids electrocular and has become increasingly accepted for many pedunculated colorectal lesions because of its favorable safety profile and procedural simplicity. At the same time, prospective randomized evidence for pedunculated colorectal polyps has remained limited. We therefore conducted a prospective multicenter randomized control trial comparing CSP and HSP for selected pedunculated colorectal polyps.
The key findings of our study was that no delayed post-polypectomy bleeding occurred in the CSP group, whereas the bleeding rate in the HSP group was 6.3%. We also found that CSP is associated with shorter procedure time and less intraoperative discomfort, without an increase in severe adverse events. These findings are clinically important because delayed post-polypectomy bleeding remains one of the major concerns after endoscopic resection. Our results suggest that in selective pedunculated colorectal polyps, avoiding electrocautery may help simplify the procedure and improve procedural safety. Overall, CSP may represent a safe and efficient alternative to HSP, particularly in pedunculated colorectal polyps with head diameter 15 mm or smaller and stalk thickness 5 mm or smaller.
More studies are still needed in large pedunculated lesions, particularly those with thick stalks and high bleeding risk. We also hope to evaluate CSP in patients receiving antithrombotic therapy and in broader real-world clinical settings.
We believe this study provides important prospective evidence supporting the clinical use of CSP in appropriated selected pedunculated colorectal polyps and may help inform future endoscopic practice and guideline development. Thank you very much for your interest in our work.